Our healthcare system today costs 18% of our GDP. In 10 years, we're going to be spending $50 trillion on our current healthcare system. And here's the thing. It's not like we're spending all this money and we have better outcomes than the rest of the world. The United States is last among all of our peers in infant mortality rates, in maternity mortality rates. We are last in terms of our life expectancy. We have the lowest life expectancy. And so here we are, the richest country in the world, and we are unable to provide health care for everybody at right now we pay double what other industrialized countries pay for their health care. So my plan says, let's take the existing, very successful Medicare system that already exists for seniors. Let's expand the kind of coverage that it offers, because that's the biggest complaint about Medicare is it doesn't cover things like dental, vision, mental health, substance abuse, some of those critical pieces. And then let's extend it to everyone in the country. Same doctors and hospitals, but you would actually be able to choose and not be limited by insurance companies that say this hospital is in-network, that hospital is out-of-network, those kinds of issues. And you won't have to have 5 different insurance plans. So what we do is we say the government is going to pay for all of this. And in the end, we want to make sure we're containing the costs. So we change the way that hospitals are paid. We take on pharmaceutical drug pricing because that is a huge issue. We negotiate now. We allow the Medicare system to negotiate just as the VA does. And we, for the first time, include long-term services and supports, which is very important for our community that has disabilities and our elders who simply cannot afford to live with dignity. Right now, the federal government already pays for about 2/3 of the total health care costs because we have Medicaid and Medicare, which are already part of the federal system. The rest of it is either people who have nothing or people who are covered by employer health care. What we are saying is that there's about it's about $600 billion that employers are paying for their health care for their employees. That money, just a portion of that, could come towards the single-payer system because these for-profit insurance companies are continuing to hike up premiums, not only for families, but also for the employers. So enormous amounts of waste that are going towards a for-profit insurance system that is more interested in their profit than patients. In addition to that, we'll need a little bit more money, and we think that's very doable by putting a wealth tax on the wealthiest. There are a number of ways to pay that last little bit that would be required. And in the end, we would have comprehensive care that really would serve every single American, and we would save, with my Medicare-for-all plan, at least $2 trillion over the next 10 years. So this is a big plan. It's an important plan. And really, it's about saying healthcare is a human right. It needs to be available to everybody, not just to the wealthiest, because as you said, 30 million Americans who are uninsured, and then on top of that, at least 40 million who are underinsured, can't pay their premiums, don't get the care they need. 1 in 5 Americans that literally does not take their pharmaceutical drugs that they are prescribed because they can't afford them.